Know this about psychologists in Denmark. I've been a clinical psychologist for 8 years, and this is what I know. Today I want to talk about what a licensed psychologist is. A psychologist is someone who has completed a Master of Psychology on university. You can use a degree in psychology for many things and many jobs. The most commonly known and what we think about when we speak about psychologists is a licensed psychologist who works with patients or clients, as we call them in private practice. Here in Denmark, we call the license for an authorization. In order to become a licensed mental health practitioner or authorized psychologist, I think it's called therapist in the States, you'll need to have completed 500 hours of assessment, 500 hours of therapy or intervention. During this period, you also need 160 hours of supervision of your work. You have to do a log of your work so you can show that you work with different fields of psychology or psychological work, such as group therapy, diagnostics, individual therapy, testing, and so forth. In supervision, you sit with an authorized psychologist and get asked about what you did and why in response to the case that you're working on. This is to help you learn how to become a better psychologist and for the supervisor to be able to assess if you're good enough at what you do. Completing the requirements with different hours of work and supervision usually takes 2 to 3 years. When you've completed the hours and gotten the signed-off approvals from all of your supervisors, you can apply for your authorization as psychologist. I know a lot of young psychologists who are lobbying to try and change the long waiting times for approval. When you're authorized, you can call yourself an authorized psychologist, and you're licensed to treat mental disorders, which means you can be paid by private insurance and by the healthcare system. As an authorized psychologist, you can open your own practice as I did, or you can work in a hospital or a private clinic. Authorized psychologists can also work as supervisors for other psychologists. Without a license, the insurance companies won't cover treatment as the license represents a mark of quality within the practitioner. It's the same way for referrals from the healthcare system. You need to have a license to be able to get referrals, as this ensures that your work quality has been thoroughly approved. You can look up if a psychologist has an active license on the ministry homepage. It's possible for the ministry to withdraw your license again if you practiced unethically or behaved unethically towards a client. I think that was all we had time for. What was your takeaway from today's video? As always, feel free to take away the information you can use, if any, and leave the rest. Hopefully you found that today's topic made sense and I didn't waste your time. Please subscribe or like this video so my channel can grow. Take care and see you for the next one.